Hello, I'm Dr. Tim Brennan. Welcome to Brennan Chiropractic and Laser Pain Solutions online presentation entitled, What is MLS Laser Therapy? We have done this program pre-COVID for almost 4 years at our office. We felt for safety reasons and for convenience, it would be a good thing for us to record so that people can consume it at their leisure and in a very safe environment. Today, my goal is that when we're completed with the program, you're going to be able to understand exactly what MLS laser therapy is, how it works, the types of conditions we treat and are appropriate for treatment, the costs involved in the treatment, the typical therapy treatment plans we utilize. And at the end, I'll go through some frequently asked questions to hopefully cover all of our bases. So let's get started here and help you understand about this therapy. So a little bit about my background. I graduated from Penn State University and Palmer College of Chiropractic many years ago. I've been in practice here in Annville for the past 31 years. My associate in our practice is Dr. David Sullivan. David graduated from Logan College of Chiropractic in 2008 and received his diplomate as a chiropractic neurologist in 2011. He has over 10 years of clinical experience and recently joined our clinic. Our laser technician is Patrick Brennan. My son, Patrick, graduated from Westchester University in 2012 and in 2016 became our certified MLS laser technician. He has performed over 15,000 treatments and on over 1,800 plus laser therapy patients. So we have extensive experience utilizing this therapy to help many, many people. We thought the best way to start this would be to outline the basics of lasers. So there are 4 categories of lasers. They're very common in our society today and are becoming more and more so. So the class 2 lasers are the grocery store lasers. Every time an item is scanned, a laser is performing that task. The class 3A lasers are the pointers, the things that our students and young people tend to get themselves in trouble with by shining in people's eyes. The class 3B lasers are the lasers that begin to become therapeutic. They're very good for surface pathogens. They're 5 to 500 megawatts in power. The basic difference comes down to power. The class 4 lasers are clinically proven effective in treating deep tissue pathologies. They are 500 megawatts and stronger. So the MLS laser specifically falls into the category 4. It is a very powerful laser. It is necessary to have a physician present to operate the laser. And our device cannot be compared to any of the devices sold online. We get a lot of questions about different infrared devices that come online, and they just can't compare to the power and the functionality of what we do. Class 4 lasers are clinically proven to treat pain and inflammation on the skin surface, but then also deep into the muscle, bone, and connective tissues. So what's the purpose of MLS laser therapy? That is our MLS robot right there. So it gives patients a safe, totally non-invasive, totally drug-free and non-surgical option to treat pain. Patients achieve faster healing, quicker pain reduction, and a natural anti-inflammatory effect. It basically jumpstarts the body's own ability to heal itself instead of chemically masking that process. There are no known negative side effects to the therapy. There's only a couple of contraindications. This treatment cannot hurt you. It was the reason I purchased this specific laser. It is designed and patented with a system that prevents us from being able to burn or hurt our patients. Patients reduce medications all the time. They are reducing the amount of medications that they take, and we've had very good success at delaying potential surgeries. We've even had patients who knew they were going to have surgery and came in and did the laser pre-surgery because of the positive effects it has on the tissue. Those folks that went ahead and had surgery actually had a much faster recovery. They're surgeons, and they were very pleased with their rate of recovery post-surgically. We'll give you some facts about this. MLS laser therapy was first cleared by the FDA for animal use in 2002, and then for human use in the United States in 2009. It's used by professional sports teams in the US and around the world. They spend a lot of money on those athletes, and they want to make sure they have the best tools available to help them heal quickly from their injuries. There's some 40 years of clinical experience and research in Europe, Asia, Australia, Canada, and the United States. Clearly, the United States has been lagging. This therapy has been utilized in Europe for years. It's just been very slow to get to the United States. It's part of why we designed this class, because we had so many people that had no idea that lasers can be used therapeutically like we are using this laser. It's proven through studies that 9 out of 10 patients achieve 80% improvement in their symptoms. And based on our thousands of applications, we can clearly support that study and its findings. There are some 3,000 papers published. There's 125 clinical studies out there. This information can all be gleaned from the Cutting Edge website if you are so inclined. The problem with research and the problem with getting the dollars for research is it's all controlled by big pharma. And right now, certainly pre-COVID, all the money was being directed towards cancer research, which is certainly justifiable. But now much of that money is going towards COVID studies. MLS Laser Therapy has been involved in a COVID study, helping patients recover from the effects of the COVID pneumonia. This is a study, again, that's provided on the Cutting Edge website if you would like to read about it in detail. The test group had a great response in recovering more rapidly, and then compared to the test group that didn't use the laser, they did not have any subsequent symptoms down the line in the follow-up. So it was a terrific case study. So who's using MLS laser therapy? There's a variety of professions in the United States using it. Chiropractors obviously using it to treat a variety of conditions in their office. Veterinarians. Why does it work for vets? Well, if you think about it, they don't have to shave the fur. The infrared light penetrates through the tissues to facilitate the healing response for the animal. And the treatments are, again, very safe and very non-invasive. Podiatrists, many podiatrists incorporate the use of this MLS laser to treat a variety of foot conditions. I am not a podiatrist, but we see a lot of foot conditions that we have treated very successfully as well. Pain management clinics are now incorporating this as a part of their treatment protocols. Orthopedic surgeons are beginning to utilize the therapy both pre and post-surgically to enhance repair and healing. And hospitals such as Johns Hopkins in Maryland are utilizing and incorporating this into their therapy protocols. So obviously the basic question that everybody wants to know is, how does this therapy work? And the biological or technical term that you'll see if you do any research on this is called photobiomodulation. So photobiomodulation, this is a cool diagram that if you want to spend some time reading through it, we'll give you a little more detail. I'm just going to highlight the overture of this. So essentially cells in our body absorb the infrared light. I like to use photosynthesis, where sunlight hits a plant. It stimulates the chemical activity within the plant so the plant can sustain itself. So it's a very similar type of process. We have cells absorbing the infrared light, which is converted into biochemical energy. The cells use this energy to cause various changes within the body. One of the first things that happens is you see the release of vasodilating chemicals. This is critical. Vasodilating means opening of blood vessels. So the small blood vessels, the capillaries in the area involved are dilated or opened. This improves microcirculation and increases the supply of cellular nutrition. So you're now opening up blood flow and you're bringing in nutrients to an area that is either injured or has been poorly circulated for a long time. The increased transport of nutrients into and out of cell membranes and organelles occurs. So not only do we get the nutrients to the cell, but it enables the cell's membrane to take in the nutrients more efficiently. The bottom line is this escalates the production of the building blocks, the RNA and DNA, which helps the reparative process. So if there's one thing I like to say at this point in this presentation is this is so much more than just a cortisone injection, which is providing sometimes a very effective anti-inflammatory effect and pain relieving effect for a short period of time, but over a long time and long usage can be very damaging to the tissue. Our therapy provides the reparative stimulation that is so crucial in what we see as the longer results of our therapies, the longer healing results of our therapies. This process in general results in normal cell functions being restored and accelerating the healing process. So the results of treatment. Basically, we see the first and foremost thing that we'll see in our treatment is we see the reduction of swelling. So anti-edema, reduction in swelling, and the reduction in inflammation. And this is due to, again, the vasodilation of the blood vessels, and then the stimulation of the lymphatic drainage. So good stuff in, bad stuff out. It has an analgesic effect, meaning a pain relieving effect. We basically are blocking the pain in the nerve cells. We're releasing endorphins, which are our body's own natural pain mediating chemicals. And more importantly, again, we're repairing damaged nerve endings there. We have optimal tissue repair. So the concentrated light results in an accelerated and more efficient healing process. We have improved circulation and nerve function. So ultimately, the infrared light significantly increases the formation of new capillaries and improves nerve function. So again, that goes back to the duration, the question that we get, how long does this therapy last? There's no black and white answer to that, but it will certainly carry on. The healing will continue to carry on beyond the end of our therapy because of the establishment of the blood flow to the poorly served areas. The overall benefits. So it's effective in both acute, meaning a new condition, or chronic, meaning an old condition. So an acute condition could be anything from 4 to 6 weeks, brand new, never did it before. A chronic condition is something that's been present for weeks, months, or even years. It minimizes the need for medications. There's no negative side effects to the therapy, and it decreases the time it takes to resume normal activities. This is the one thing that we see from patient after patient, is that they're able to get back to doing the activities of daily living that the injury or the chronic pain had been preventing them from performing. So typical injuries or pathologies that we recommend for MLS laser therapy treatment. That is Patrick providing a treatment to a patient with an elbow condition right there. So in this column, we have the pains. So any kind of pain, low back pain, neck pain, which chiropractors see all the time, but knee, foot, ankle, radiating nerve pains, shoulders, headaches. This is an interesting one. Many people don't think about the headache possibility, but if the headache is cervicogenic, meaning it's emanating or coming from the neck area and coming around almost like a hat band pattern, it often comes from inflammation at the base of the skull and at the top of the cervical spine or the neck area. And we've had very good success at reducing that irritation and inflammation around the nerve endings, helping people to feel much better, much faster. This column, these are the inflammatory conditions. So anything ending in itis, I-T-I-S, is a suffix which indicates inflammation. So arthritis, tendinitis, bursitis, myositis, plantar fasciitis. Those are all conditions that benefit from the anti-inflammatory effects of the therapy. I don't like to describe this therapy as a panacea, a cure-all. It's not. There are, however, probably many more things that we can treat with this therapy than we cannot treat, quite frankly. And the way we determine that is through our exam process. So what would you expect moving forward as a patient? If you chose, based on this information, to come to our office, this is what we're going to do. We're going to schedule a consult and an examination. So we get to know your condition specifically. You'll meet with one of the doctors directly, and we will talk about your condition. We will then perform an examination. Any information you can bring to us, x-rays, MRIs, CTs, blood work, anything you have that will help us make a better diagnosis of your condition would be greatly appreciated. I have the ability to take x-rays here as well if we needed to take our own x-rays. From that information, we're going to put together what we call a report of findings. And in that report of findings, we're going to answer 4 things. Number 1, what's wrong? Number 2, is what's wrong appropriate for treatment utilizing the laser therapy? Number 3, if it is, what would the treatment plan be? How many treatments do you need? And finally, how much is that going to cost? So before you leave, you'll have your questions answered and you'll know whether you're going to choose to start therapy. If you decide to start therapy and we believe it's appropriate, essentially the typical laser treatments last anywhere from 15 to 20 minutes per area. Now, we can treat 2 areas on some patients, so treatment times can be 40 to 50 minutes, depending upon their condition. There's no discomfort from the treatment. This can't be said enough, because the number one reason people don't do laser therapy, or the number one question we get when we would do this class, is, does this hurt? Does it burn? Can we cause damage? We cannot, again, specifically because of our laser. There are class 4 lasers out there that are and can be harmful if they're not used correctly. Most patients notice improvements within 2 to 4 treatments. We've had patients get right up off the table after their first treatment, noticing change. I've had other people that take 4 to 6 treatments. It all depends on how your body absorbs the light. It's a very individual situation. You can expect to relax during your appointments. Again, relaxing and being able to be comfortable is our number one priority. So our ultimate job is to make sure you get a good outcome. It's what's best for you. It's what's best for us. We have many people referred to us because we've gotten great results. And so with every patient, we want to make sure we get the best results. In light of that, it's important that we make appropriate treatment decisions and give you plenty of options for treatments so that you can get the best result possible. If it's a spinal condition, for instance, we may recommend chiropractic therapy. And there's a lot of different ways to do that. We have a very safe, non-invasive instrument that uses a percussive vibrational application that we get great results with. We don't have to do the traditional adjustments if they're not appropriate or desired. We use a significant amount of decompressive traction therapy in our office. If you have a neck condition or disc condition in your neck or your lower back that's pinching a nerve or causing radiating pain, decompressive therapy is a tremendous tool to help alleviate, and couples extremely well with the laser therapy to promote a healing response. We have a CBD product that is excellent. It's one of the best on the markets that we can discuss if it's appropriate for you. Supplements are available. There are many different supplements on the market that help stimulate the healing response and also reduce inflammation. We can share those with you if it's something that you're interested in. Exercise programs are critical. If we get rid of the pain and inflammation, we want to start to build strength and range of motion within the area that we've treated. Massage therapy is something that's available. We can utilize soft tissue massage and stimulation to help, again, promote the healing response within the injured area. So for ankle, knee, hip patients, even low back patients, if the base of your situation is incorrect, in other words, if your feet are poorly structured or supported, that's going to create an erratic pattern up through the legs and into the hips and lower back. So we use orthotics from foot levelers and have had great results in stabilizing those conditions and helping people get better faster. and again, lasting longer with their results. So there's a variety of accessories for sleep, exercise, and daily life that we will share with you and recommend if we feel they're appropriate, again, in order for you to get the best outcome. So there's 4 things to know about your individual plan. No two people heal alike. If I've learned anything in my 30 years of practice, it's that no two people heal the same way and the same timing. So every person is different and you will be managed as an individual. The severity of your injury, how long ago it occurred, and the type of injury you have heavily influence the treatment recommendations that we make. The number of treatments are determined specifically by your examination and your specific condition. One of the doctors here will establish that treatment plan, and you will agree again with the doctor upon the treatment plan before you start. It'll be thoroughly explained to you. Treatments typically consist of 2 to 3 times per week for 2 to 6 weeks, depending upon, again, the nature of the condition. That would be very typical in our treatment regimen. And upon completion, you will have a reevaluation with one of the doctors to determine the progress. Have we completed the process and we can release you, or is there some additional therapy that needs to be done? So this is the question, and this is the answer to the questions that most of you have been waiting for and looking for, is what's the cost? So we utilize $50 for our laser evaluation charge. The cost per treatment is $60 per area. Double treatment areas can be done. And if it's a double treatment, it's $120 per treatment. So it's $60 per area. In other words, if a single treatment takes 20 minutes, we're using 40 minutes, it is 2 times the cost. But we have many patients that get through treatment, they do extremely well, and then they want to utilize a maintenance process. In other words, they want to use the therapy instead of having to go back to taking NSAIDs or over-the-counter medications to maintain their relief from the pain and inflammation. Once a month often is utilized, and we use that at $50 per service. So there's no insurance coverage for laser therapy. This is the number one question. Besides, does it burn? Is there insurance coverage? There are no therapies, there's no insurance companies at the present time that provide coverage for laser therapy. We will certainly accommodate your financial situation as best we can. Typical plans, if you want to get a typical plan, if we treated an acute or new injury, maybe an ankle sprain, right? 2 weeks of treatment, one area at 3 times per week would be $360. A typical, let's say we have an arthritic knee, a chronic knee, it might be 4 weeks of treatment, one area at 3 times a week would be $720. I hope that answers those questions for you. Those are the answers that we will, again, before you start care, you don't have to memorize this, we'll be going over specifically what we need to do in order to get you well. So let's recap. MLS Laser Therapy is a state-of-the-art technology that naturally reduces pain and inflammation, and it promotes wound healing and soft tissue repair. It's drug-free, non-surgical, totally non-invasive, safe, and there's no negative side effects. Laser therapy has been around for decades. It's just relatively new to the United States. FDA cleared in 2009, again, for human use with no negative side effects. There's various types of medical clinics utilizing this device, as we outlined. We have literally years now of experience and success with using this laser very successfully to treat a variety of conditions. And we will do whatever we can to help you recover. So some frequently asked questions. I hope I've answered most of your questions at this point, but we do have some questions that I think we'll re-emphasize here. Number one, does the laser burn? And are there any negative side effects? Absolutely not. The laser is patently designed to prevent burning, what we call a thermal effect within the tissue. It's extremely safe, and it was the number one reason I purchased this laser. There are other class 4 lasers that are very powerful, but they're almost used like a hand wand, where the wand has to constantly be moved over the tissue to avoid a heat buildup, or what we call that thermal effect, which can definitely create burning and tissue damage. This laser, being robotic, allows us to position it safely and create a treatment area that will be very specifically dosed and again, extremely safe. How long until you notice positive changes? Again, I've had people get up after one treatment noticing change. For most people, it's between treatment 2 to treatment 4, they really start to see and notice the changes. How long do the effects of laser therapy last? This is an unknown question. It's again dependent on the individual, their case, their condition, their functionality, etc. The key is that it's not just like cortisone where it's going to dissipate and be gone from the system. The fact that we restore blood flow to areas allows the nutrition and nutrients to continue to bathe the area and allow the body to continue to repair and maintain the level of inflammation. Is it safe to use this laser to help me heal faster after surgery? Absolutely. This is a question we get because many people will ask their surgeon, can I go or have laser therapy? And the surgeons, mostly because they don't understand how the laser works and they don't want to create any situation that might interfere or they might get blamed for, will say no. Post-surgically, this is a tremendous tool to stimulate the healing response. It does exactly what the body's asking for, which is to bring blood flow into the area, nutrients, oxygen supply to create healing response. Plus, the laser is terrific for killing surface bacteria. Can we treat over replaced joints or surgical implants? Absolutely. Again, this goes back to the first question there. We don't build up heat in the tissue, so we can treat through plates and screws, knee replacements, hip replacements. The fact that we don't build up heat allows the tissue to be treated very safely. And it is a process that we have a lot of experience in handling. Do we treat blank? At the end of every class, we have 5 or 6 hands go up asking us about these individual conditions. And basically, the only way I can answer this for you is to come in, do a consultation, let us do an examination to individually answer this for you. There are cases that we have turned away because of the complications involved, but there are many more cases that we can help. So if you are interested, you want to follow the following procedures. Basically, to set up an examination, you can call the office at the number listed. You can email us at info@drtimbrennan.com, or you can contact us through the website at www.drtimbrennan.com and click the Relieve My Pain Today button. I want to thank you for your presence here with me today, and I hope that I was able to answer your questions and allow you to make a decision to come and allow us to see if we can help you feel better and function better.